guys, good evening. I'm so sorry for not being able to do live sessions since last 3 days. I know I'm really irritating for some people, but I agree because this is what has been happening since with me from last 3 days. So I hope you understand. It's just 3 more days, and from 23rd or 24th onwards, I will be easier and relieved again. And the reason behind me doing this live session a little earlier is because I have to go in between again. I just completed my job soon, and I came to do this live so that I can maybe do at least 2 hours of live session. So yeah. Okay, then I am planning to ask some questions in the very first, beginning of this live session. Is it okay with you? If okay, please let me know so that I can ask you with some, you can start this live with some questions. I didn't plan anything to ask, but I'll try to do my level best, okay? If that is what is comforting you, then I will definitely do ask the questions. Okay, okay, Krish, then I will proceed in asking questions. The very last thing I did before this session was my friend is asking some questions to me, so the first question I would proceed is with that. The thing is, so can somebody tell me for which drug is cutis aplasia a side effect? So cutis aplasia is a side effect of which drug? Please let me know in the comments. And great Mrinal, yes, you are right, it is for methimazole. Yeah, Krish, you are right, it is for methimazole. Yeah, methimazole and carbimazole both can be the answers. And what does lithium cause? Okay. Having said that, can you tell me which type of heart disease lithium comes under, whether it is cyanotic or acyanotic, with plethora or without plethora? I'm just asking questions, even I don't remember things, but I'm trying to recall because it is little bit. Yeah, I'm not teaching anything, I'm just asking what is being taught to us, okay? Yeah. Yes, I think you are right, Mrinal. It is a cyanotic heart disease without plethora, as I have remembered. Just please confirm it in your books. I just wanted to make you remember that. And continuous machinery murmur is seen in. Yep. Yeah. No, I'm a doctor, not professor. Great. And where else we see Graham steel murmur? Great Subramaniam, you're right. Great Mrinal, good Krishna. And can you? Yeah, great. No, it is pulmonary hypertension. No, this is called one-to-one interaction, nothing more than that. Okay. Okay, then which murmurs? I mean, if preload increases, which murmurs decreases? Hi, doctors. Yeah, HOCM, and another will be there. Another condition also. Great, fit talk. Great. Congratulations. Yeah, HOCM and Is it MVP or is it aortic regurgitation? Because I just don't recall it properly. If anyone knows, please let me know. I think it is, yeah, sorry, aortic regurgitation stenosis. MVP, I think it is for afterload. Please confirm it and let me know, guys. I don't know. I'm very weak at this portion of cardio. Just hoping this phase would go okay. And coming to, as we are here, maybe I'll ask this. Can you tell me atrial myxomas, schwannomas, which also comes under men syndromes? What is the triad I'm talking about? If anyone knows, great. Great, Mrinal, you're right. I'm talking about, yeah, great, very nice, Krishna. Very nice. Yes, Subramanyam, I have asked that, Carney's complex, which consists of atrial myxomas, not just atrial, but there are many myxomas in the body, and schwannomas, and I think I don't remember anything. If you guys let me know. And also it comes under men's syndrome, Subramanyam. I think you have to revise that part. And can somebody tell me what are the triads seen in men 2 syndrome? Triads seen in men 2 syndrome. Men 2 syndrome. What are the conditions you see in men 2? And what is the gene? Great, Mina, you're right. Yes, Krish, you're right. Great. And yeah, what is the gene seen there? What is the drug of choice? Sorry, what is the investigation of choice for pheochromocytoma? Investigation of choice. Yeah, red gene. That is the reason, I mean, we also have medullary thyroid carcinoma having the same gene, red gene. Okay. Yeah, VIAA. Thank you so much, Fit Doc. It's okay if you don't know about these. You will eventually know. Yeah, it is. Yeah, plasma metanephrines is the investigation of choice. Urinary is like screening test, Krish. Okay. Plasma is investigation of choice. Okay. You're confused? No. Urinary metanephrines and yeah, I think you understood, right? Okay. Can you tell me in extraadrenal pheochromocytomas which organ is more involved, and what is the most common catecholamine involved there? Extraadrenal pheo and come on guys, try. What is the most common place for extraadrenal pheochromocytomas? I mean, I think it has some specific name for it, something starting with Z, if you want some hint. Yeah, great, Mrinal. Yeah, you're right. Yeah, paraganglioma, Zucker candle, great, Krish. Can you tell me what is the most common catecholamine in extraadrenal pheo? No, sorry, quite Subramanyam. Just learn from it if you don't know, and we can do the same. Right? Sorry. Yeah, Zucker candle, Radhe, you're correct. No, Mrinal. I think it is in between epinephrine or norepinephrine. I just don't recall it properly. Once, see it and let me know. Yeah, I don't think it is dopamine. It is definitely not. But either it is norepinephrine or epinephrine. I think it is norepinephrine only. but at the same time I also have then it is norepinephrine, it is not dopa. Okay, yeah, then it is norepinephrine. If wrong, please let me know too, because I may forget it and I keep wrong. Yeah. Okay, not more than epi. Thank you for clarifying, Radhe Radhe. And can you tell me what is the management of choice for stage 3 retroperitoneal, grade 3 retroperitoneal trauma? What we'll do? What happens in what is grade 3 retroperitoneal trauma? We have 4, right? That in RP trauma. Retroperitoneal, we have 4 quadrants, middle, sides, and I'm asking about third one. What do you do there? No, it is not midline structures, Krish. Midline structures are grade 1, like iota and IVC will be the first grade, and second is like, yeah, pelvic. Mrinal is right, is pelvic, and fourth is like retroperitoneal, retrohepatic IVC. So yeah, it is pelvic, Krish. Okay, yeah, you have to do conservative. It is better to give pelvic binders. Yeah. NOM, what is NOM? I didn't get you, Mrinal. Can you please elaborate? Yeah, Akshay. Okay. And having asked that, maybe I'll go to this. How will you differentiate between stage 2 and stage 3? I mean, I don't know what is stage, grade and all, but blood loss, in blood loss, how do you know it is 2 or 3? I mean, can you tell me the differentiating points between them? What changes? Okay, non-operative management. Okay, Mrinal, got you. So, can you tell me now what we'll see in that? Yeah, in which one heart rate is increased in stage 3, and also one more thing. Yeah, 120 to 140 in stage 3, and blood loss, in terms of blood loss. Yeah. I don't exactly remember, Krish, but I think BP decreases. Overall, I know, but I don't know SBP and DVP. I think you are right. SBP will fall and DVP will increase. If we are wrong, please correct us. BP overall will drop. Yeah, 1500 to 2000 ml. Great, Mrinal. Okay. 40 more. What is 40 more? BP decreases and heart rate increases. That is the differentiating point which is present in stage 3. And the blood loss amount 1500 to 2000 ml. Play between 700 and 2000. Can you tell me what is the ulcer which is present in medial malleolus, gaiters area? Other buzzwords for which ulcer? Okay. Yeah, great, Krish. It is venous ulcer. Yeah, Prajwal. Regarding RR and CNS, can you please elaborate? I mean, I don't know. So, if you know, similarly, meaning up to stage 4, I understood, but after that, I didn't get you. Can you please elaborate? I'm not studying cycles, Subramaniam. It is just to, just know glycolysis and gluconeogenesis. And major steps of urea cycle and Krebs cycle. I think you are sorted more than enough. That is what I believe, at least. I think you have to consult a doctor, Akshay, first. And coming to, as we are at venous ulcers, what is the grading of a venous ulcer in varicose veins? Which grade we give for venous ulcer, active venous ulcer? Yeah, it is CAP. I'm asking the stage. No, it is not C2. Yeah, it is 5. It is 5. 6 or 5. It is 5 only. I hopefully think it is 5 because 4A, 4B, 4C are the lengthy names. So C5 is healed. I think C5 is healed and C6 is active venous ulcer. I think C6 is only right, but please check it once. C6 is only healed. I don't think so. I think first is healed and then active. Just check it out. As I said, C6 only. Yeah, 6 is active. Just now I have seen it because first healing happens and then again it becomes an ulcer. So 6 is active. Yeah. Great Prajwal, great Rudra. Yeah, Krish. Yeah, 6 is active. That is what. Yeah, Mrina, you're right. And then have you got your confusion clear regarding edema and eczema? Which stage is edema and which stage is eczema? Try to recall it. In venous, in varicose veins only. 3 is what? Yeah, Mrunal, you are right. 3 is edema and yes, 3 is edema and eczema is 4. Great, Krish, you are right. Yep. Yeah, 4A. In specific, we have to be 4A. I think 4A is a good enough answer. And having said that, where are we? Edema and eczema. So we'll jump to dermatology for some time. Can you tell me the example for erythema migrans and erythema multiforme? And what is the drug of choice for erythema migrans? I remember the disease, but I don't remember the drug. I'm thinking. Great, it is Lyme's disease. You're right. Caused by which organism? Great, Pratik. Yeah. I think doxy is correct. Okay. I actually forgot the drug of choice. Okay, doxycycline. Borrelia recurrentis. You're right. It is Bugdorferi or recurrentis? I'm just confused now. I don't know. Bugdorferi. If yes, then what is for recurrentis? Please let me know. I just forgot. Okay. If it is complicated, we have to give cefixime. Okay. Thank you, Prajwal. Doxycycline is good. Okay. Okay, I think many people are going with Bugdorferi. Okay then. Then what causes Borrelia recurrentis? The next question is that. Yeah, everything is from BTR probably because I am the only one using completely from BTR. Only BTR, I am not using any DVT. Then recurrentis causes. Okay then, as you have said that, maybe you are right. Okay. Then NIH swab is for which organism? NIH swab for which. Okay. Thank you, Jeevan, for letting me know. Okay. Yeah, I have recurring test and relapsing fever. Post one-on-one. I think now I'm clear. Yeah, great. It is introbius. Once again, I'm just recalling myself. Yeah, I think introbius vermicularius is the correct answer. Great. Great issuing. Nice visual. Then what else should I ask? Okay. Segon's fracture. I've asked it previously, I'm asking again. Segon's fracture is for Kienbock's disease. Yeah, Pillai. It is mixed bag discussion. Yes. We're just flipping through one-on-one like that. Yeah. Yes, Minal is right. It is ligament. Yeah, Kienbock's is lunate. Krish, you are right. You are right. Yeah, correct only. And what is this? Through and through fracture of vertebral column. All the columns will be involved and destroyed. What is the fracture name? Yeah, great. Great Vismay. It is chance fracture. Nice. No, it is chance fracture. Great Krish. Nice Rudra. And yeah. Then can you tell me bamboo stick fracture is seen in? That stick fracture, bamboo stick fracture is seen in? Great, great Pratik, you are right. Jacob, I think third and fourth should be the marks for final year. That is what I have considered it as. Yeah, you are right, Krish. It is Angst Pond. Yeah, great guys, you are right. And can you tell me where else we see this beveled margins in the skull? Beveled margins in the skull is seen in? What problem? Yes, LCH, you are right guys, correct. No, it is LCH. In multiple myeloma, what do we see? What findings we see in skull? Very characteristic, multiple times asked question. We see thank you, Moria. No, punched out lesions. Yeah, punched out is what? Punched out lytic lesions is what I know. As you guys are telling, is raindrop another name for it? I don't know. Please let me know if it is another name. Okay, yeah, punched out multiple lytic lesions is what we see. And can you tell me what is the management for less than 65-year-old? Take it as maybe 40-year-old guy who came 1 month after the fracture for neck or femur fractures. I'm asking about. So 40-year-old neck or femur fracture 1 month back. So what do you do now? Condition normal. I didn't get you, Yami. I mean, I'm directly giving you that the patient is having neck or femur fracture. No. I think because he is 40-year old, which is less than 65 years, and the patient is having fracture which is 1 month old, which is untreated. What should you do? Yeah, osteotomy. I think Rudra is right in regards this. I don't know why MRI, but osteotomy is right answer. Okay. I mean, I don't know if next step is it MRI, but I'm asking about the treatment, the management of it. I'm a little confused now, but the answer is osteotomy only. Okay. And okay, maybe for the next 5 minutes we'll continue the questions and then we'll study. Okay. Okay, to see the viability. Okay. Okay. Okay, B. I mean, if it is in the next step, that is good. If they ask you about management, I think osteotomy should be the answer according to VTR, but I don't know. As you people are answering, it is MRI. Okay. Okay. Even though if they ask us about management, should we do that? Okay. I mean, if MRI is in the option and osteotomy is also in the answer, should I mark MRI? If yes, please let me know. Muscle grafting, in here, in neck of femur fractures, muscle grafting, I don't know, Mrinal. I don't think it is the correct one. Okay, then can you tell me where else we see HLA, DR3 and DR4 mutation? HLA, DR3 and okay, for blood supply. Okay. Okay, Mrinal, I understood. Yeah, actually in specific it is DR4 for rheumatoid because rheum has 4 walls, so rheumatoid arthritis. DR3 and DR4. Celiac will have DQ2, DQ8 polymorphisms, right? It is not DR3 and DR4. Yeah, rheumatoid arthritis is right. SLE, I think it is DR2 or something, Krishna. I think it is DR2. If wrong, please correct me. SLE. SLE also this one only, DR3 and DR4. Okay, I'll just have to revise it, that part. Okay. And with ankylosing spondylitis, HLA B27 along with angspon is Ritas. So I didn't understand your question, Pillai. Okay, SLE is also DR3. Okay, Nemo, thank you. I didn't understand the question only, so I just. Time of absorption. Okay, I think somebody answered it actually. Great. I'll let you know, guys. Just stay a little bit longer. Okay. Okay, got it, Pillai. And then I was thinking of what to ask next. If you can initiate too. Some questions you guys can initiate. I'll try to answer. PR 65. Is it for HIV? Okay then. Last question. Okay. It's already half an hour of discussion. Okay, it is cytomegalo. Okay. Thank you, Abhi, for letting me know. To advise her to take barrier methods, because if ampicillin is used and it induces the OCPs. Initial and golden. Okay. Initial we check for celluloplasmin levels, right? And Wilson's gold standard is biopsy, liver biopsy. Thank you, Dr. Arun. Post-exposure prevention of influenza. I don't know, Jeevan. Please let us know. Yeah. Great. You can volunteer, guys. Any other questions if you want to ask? Some new updates, or I want you guys to ask difficult or new questions only may come in the exam, right? I think he's asking about post exposure. Baloxavir. Okay. Thank you, Jeevan. ICAM is for common rhinovirus, right? Rhinovirus, it is there, and what else? Is it for COVID-19 also, right? Yeah. Plasmodium. Yeah, I think it is there too. Hemorrhagic cystitis is acrolein causes, right? Cyclophosphamide causes the hemorrhagic cystitis. Adenovirus. About what, Nemo? Yeah. Okay, then I think now is the time we stop here and begin to study. Actually study, okay? I hope this Q&A is useful to you guys. Continue studying. Don't worry about Q&As. It doesn't matter. The questions may or may not be asked, so don't get depressed if you are not able to answer. Just give it your best for the next 20 days, 25 days. Okay? Yeah, you're asking conjunctivitis. Okay. Radiation recall. Is it in leukemias? I don't know, but please let us know the answer, Mrinal. No worries, Subramaniam. Artemether atobat cone, what to use? Can you please tell the answer, Mrinal? Radiation recall syndrome. Okay. Is there any drug in specific? Yeah. Okay, doxorubicin. Okay. Thank you, Mrinal. Yeah, doxorubicin. Got you. Thank you so much for making us learn new point. Okay, then I hope it is useful to you. Let's begin. Let's not waste our time and start studying again, because I'm lagging behind so much in BTR schedule. or else you can continue, asking questions in the chat box while I begin. Okay, I'll just mute myself. Thank you, Krish. And they don't stay, Krish. They just log out after the Q&A. Some people will treatment for congenital hernia. So I think it is surgery, right? What else we do? Is there any name for it? Herniotomy. T2 blocking property in atypical antipsychotics. Atypical, right? Is it haloperidol? Okay. Bye, Subramaniam. All the best. Okay, risperidone. Okay. Bye, Radhe Radhe. All the best. Oh, oh. I didn't even remember the classification now. I think clozapine and all the other, except those three drugs, everything is atypical, right? Haloperidol, ziprasidone, and what else? Thioridazine. Only these three are typical, right? Okay, both Doxo and all else. Okay. Thank you, Sirisha. Okay, madam. Clozapine is like metabolic side effects, and there will be no sweating, lot of sweating. Very confusing drugs. I think Silovia is with clozapine only, and sweating is with the other one. Sumant, I have to start ENT today. I somehow finished Optal with utmost difficulty, which I don't like the subject at all. So, yep. Wet pillow syndrome is also with clozapine, right? Because of the siluria only. Okay, then please continue to study, guys. I have a lot to finish. I have no time also. Kanhaya, thank you so much for your advice. As an MO, I know how it feels to be able to study alone. Thank you so much for your intelligent kind of comment. And while you watching this cheap activity here, go ahead and do whatever you want. And I have to leave. Thank you so much, guys. So thank you so much for watching this live till here. I'm just closing it here, guys. Bye bye.